So welcome everybody to the Confident Care for Kids training, VAX visits with less stress. We are so thrilled to have you here with us today. Today, we hope to have a guided discussion with the goal of helping to create inclusive vaccine experiences for children and youth with developmental disabilities, delays, and or sensory sensitivity across Vermont. So we just have a few logistics. I want folks to know that you can absolutely post your questions in the chat box. We're going to be running through a lot of content. So definitely post your questions in the chat box, and we will have somebody, we will have time at the end to go through those questions. There is live transcripts that are turned on. And also, we want to remind you that this session is being recorded. What else? What are the logistics? Also, at the end of this training, we're going to have a link to a very, very short evaluation that we're really, really hoping that you can find the 4 minutes to complete that evaluation. That's really going to help us know, how helpful and useful this training was for you folks. So I think that is everything for logistics. If I've missed anything, our trusty partners from Vermont Family Network will make sure the logistics are put into the chat box. So again, thank you for being here. So the Confident Care for Kids campaign or project is a federally funded, state-managed, multidisciplinary project. It's made possible by the following organizations: the Vermont Developmental Disabilities Council, the UVM Center for Disability and Community Inclusion, the Vermont Family Network, the University of Vermont Children's Hospital, and the Vermont Department of Health Children with Special Health Needs Division. Some key partnerships in ensuring that this training is so successful have been the Empower team from the University of Vermont Children's Hospital. Thank you so much for being here. The Vermont chapter of the American Academy of Pediatrics, Dr. Melissa Hauser of All Brains Belong, Christy Trask and Krissa Jameson from UVM Children's Hospital Pediatric Primary Care, Jennifer Hazelman, who is a parent partner and special educator, and Karen Downey, who is our OT consultant. So thank you all for being such a key partners in this incredible project. Now, why is this so important? You may be wondering, in this age of COVID, ever-evolving processes and protocols, why is it important that we really focus on kiddos with developmental disabilities, delays, or sensory sensitivities? Well, it's because we have over 24,000 children and youth in Vermont, ages 0 to 17 years, who have a developmental disability or special health care need. So it's very, very crucial that we create environments in which they feel safe and have positive experiences, so they will continue to come back and receive the health care they need. So our time today is going to be consisting of a personal narrative from one of our parent partners, Ashley Michaud. We're going to hear from Karen Downey on what is sensory sensitivity and stress and why is it important to recognize this. We're going to learn from two incredible nurses, Leanne Poirier and Jessica Putvane, on how folks can make it better in their practices for children with sensory sensitivities. We're going to learn about comfort positioning from Jessica Rabideau, who is an incredible child life specialist at the University of Vermont Children's Hospital. Karen Downey and Jessica Rabideau, again, are going to bring you through the right tools for the job and sort of go over those sensory support items. Then we're hoping that we're going to hear from Jennifer Hazelman about who has another personal narrative for us. And then, if all goes well, we're going to have enough time for discussion and next steps. So that's our time for today. And now I'm going to kick it off to Ashley Michaud, who is one of our incredible parent partners and or patient family advisors, as we like to call them, at the University of Vermont Children's Hospital. Ashley's been involved in something called the Empower program for about over 2 years now. So Ashley, please share with us your experiences, and thank you so much for being here.
My pleasure, Charlotte. Let me just switch on over. Hi, thank you for being here and listening to my family's story. My name is Ashley Michaud, and I'm a patient family advisor working on the Empower team. My 3-year-old daughter, Hazel, is diagnosed with Joubert syndrome, which impacts almost all areas of her development, including communication skills, coping, and sensory regulation. On top of all of that, Hazel is medically complex. I want to start by sharing a recent experience we had that reaffirmed why projects like Empower and creating sensory-friendly and safe vaccinations are essential to our care. Recently, we received care at another hospital. This was a new environment for us, and unfortunately, our pre-op experience did not go well. Almost everything that could go wrong did go wrong. Our bed was not in a private space, but next to a busy door. It was loud and busy, which only increased Hazel's anxiety. She was so anxious, we couldn't even get her onto the bed to get changed. We did not have access to Child Life or other sensory tools, and the dose of Versed did not have the desired effect. As you can imagine, the experience went from bad to worse when it came time to place an IV. It took 3 of us holding her down while she screamed, gagged, choked on her own phlegm, bit her lip. The trauma does not end there. It's taken 5 days to get her to change her shirt, remove the Band-Aid, and take a bath. Multiple times a day, I need to kiss her arm and reassure her. I fear for what our next IV or blood draw will look like. Our experience did not have to be like that. We needed someone to ask about her sensory needs, what worked in the past. We needed a private, quiet space, sensory tools like bubble wands and fidget toys, and we needed it to go slow to make her relaxed and as comfortable as possible. Projects like Empower and Safe Vaccinations provide a necessary support for our family to have a positive, family-centered approach to care so that anyone on Hazel's medical team is aware of what she needs, and as a team, we can have a plan. Our Empower stays have been amazing. The most impactful part for me is being asked and given a chance to talk about Hazel. It is incredibly powerful to have a conversation around all of her needs and come up with solutions and tools to best care for her. I never doubt that any healthcare provider always wants Hazel to have a safe and relaxed experience. But to make that happen, her developmental and sensory profile needs to be considered. When this happened, Hazel has a positive experience and staff have a positive experience. I think Hazel would say that choosing sensory items from a visual menu is her favorite part. Her face lights up when it's presented to her. Most of the time, so much of what happens is out of her control. So to find a way to give her a voice and access to items that help keep her body regulated is like a little bit of magic. We know that not every procedure, vaccination, or appointment is going to go as planned. It's an evolving process. But the most important part is that all of us are learning and trying to make it a better experience. I will forever be grateful for the Empower Project and projects like this, empowering Hazel and our family. Thank you. I'll now turn it over to Karen Downey.
Thank you, Ashley. Hello, everyone. I'm Karen Downey. I'm an occupational therapist, and I've worked for many years in a variety of pediatric settings, including large medical centers like the University of Vermont, as well as home health, and most recently in public schools as a school-based OT. We ask, why are sensory sensitivities and stress important? We're processing our environment through our senses constantly: sense of taste, smell, sight, hearing, touch, and vestibular and proprioceptive. The 5 basic senses we're all very familiar with, but the last 2 are the hidden senses. The sense of vestibular is the process that we basically have receptors in our inner ear, and whenever our heads are moving in a different position or we feel motion, the vestibular system activates. It's very important for development of balance and motor coordination. The proprioceptive system is processed through our joints and our muscles. This is the system that helps us lift ourselves up against gravity, so we learn how to sit, stand, walk, and do other complex motor actions. The whole balance of the vestibular and the proprioceptive with the touch system makes a very good foundation for us as we develop our other sensory awareness. Over the past 60 years, scientists and healthcare practitioners have come to understand the importance of sensory processing in human development and in healthcare. Therapeutic Sensory integration was first developed in the 1960s by an occupational therapist by the name of Jean Ayres, who was also an educational psychologist. Sensory processing knowledge has led to the modification of intensive care, neonatal intensive care units, for those of us that remember that back in the 1970s and 80s. It has also led to infant stimulation and infant massage programs that demonstrated reducing stress and increasing social engagement for young children. Sensory awareness studies have also taken place with children who have experienced developmental trauma and global neglect. And we know that children who have suffered these situations definitely have sensory sensitivities, and we are looking at how to approach to regulate and help them be more regulated and engaged. Sensory tools help increase and decrease stimulation from the environment with the goal of regulation and optimal arousal. You will hear the words sensory defensiveness, sensory avoidance, as well as sensory seeker. And these are different ways that children can respond to input in their environment. When a child does not have good organization of their senses, they can go into an emotional or behavioral dysregulation. It can trigger fight, flight, or freeze reactions. And as Ashley was describing, it sounds like that definitely was occurring. We want to enable a child to receive sensation in a just right manner. And in this way, the child can be more alert and engaged. We know through recent studies in pediatric dentistry that using sensory tools such as video glasses, headphones, and pleasant smelling dental floss or dental polish can really reduce anxiety and pain perception in both children and adults. There was a very good study that came out within the past couple of years on that. So lastly, to say sensory support systems can calm, distract, and redirect children during their visit. We ask you to keep an open mind at this time. It is a time of high stress due to COVID. And if you could try one or two of these sensory tools or strategies and start on your own path of providing more sensory-friendly vaccination experiences for the children that you see. Thank you.
Hi, my name is Jess Putvane, and I am a nurse on Barrett 5 inpatient pediatrics at the UVM Children's Hospital. I'm also one of the members of the Empower team. So I was just gonna tell you a little bit about the Empower program. So this program was created to partner with families of patients with developmental disabilities or delays while they're in the inpatient hospital setting. Recognizing the unique needs of these patients, families are asked a few questions upon admission regarding how best to care for their child. So just some examples of these questions are, how should we approach your child? How does your child show they're in pain? What are some early signs of frustration or common triggers for your child? And does your child have any sensory preferences? These questions and answers are then made available to the child's care team by the electronic health record. An Empower sign is placed on the patient's door and a banner is in their electronic health record chart, alerting the care team to pause, review those questions and answers prior to entering the patient's room. Additionally, we created a sensory cart that was funded by a grant from the Children's Miracle Network. The items in these carts are made available to the Empower patients, and they help provide distraction and comfort them throughout their hospitalization. Our goal with Empower is to empower patients and families to speak up regarding what works best for them and their child, and also to empower staff to feel more comfortable caring for children with developmental disabilities or delays, so that when the care team enters that patient's room, the opportunities for successful exchanges and interactions will increase. So we implemented this program in the inpatient hospital setting, but the core concepts can be equally beneficial in an outpatient setting, and especially for vaccinations. If staff have some insight regarding how best to approach a child during the vaccination visit, prior to the visit, this could lead to a less traumatic experience for everyone involved. Go to the next slide, please. So we recognize that healthcare staff already have a lot on their plates right now. And although providing great patient care experiences is something that we all strive for, implementing new workflows can sound daunting at first. So I just wanted to go over a couple scenarios that kind of shed some light on how there's potential that these interventions can actually decrease your workload and improve efficiency for all. So my first example is about a patient named Sally. So Sally has difficulty taking oral medication. Her nurse spent 30 minutes trying to find a way to get her to take her antibiotic. After lots of attempts, success. The nurse then passes on to the next nurse. Sally will take her antibiotic when it's mixed in chocolate ice cream, and she loves pretending that she is Doc McStuffins. The next day, it only took 5 minutes for Sally to take her medication because the nurse had this information ahead of time. So now we're going to talk about Johnny. Johnny needs monthly lab draws. In his chart is his poke plan. Johnny prefers to sit on his mother's lap and look at an I Spy board during the draw. He does not like to watch, but he does want the nurse to count to 3 before the poke. Johnny's lab draws go smoothly once his plan was implemented and followed. So our overall idea and hopefully take-home message here is there's power in making a plan ahead of time, and that hopefully taking an extra couple of minutes prior to the visit could actually lead to shorter visit times and more efficiency overall. Thank you.
Hi, my name is Leanne Poirier, and I am a nurse on Baird 5, and I am also a member of Empower Team. I'm going to discuss the questionnaire that we came up with for you to do prior to the appointment, and we'll discuss that more in detail in a little bit. So the questions that we're going to talk about can be modified to your own practice. Number 1 is, what has worked well for your child in the past while receiving the vaccine? So sometimes distraction is helpful, using one of those tools that we're talking about in the cart. Sometimes explaining the steps, step by step, what's going to happen. Sometimes sitting on a caregiver's lap and feeling comfortable by that. Sometimes using a visual schedule of steps. So taking pictures of each of the steps to make it more visual for the child so that they know what the next step is helpful. Sometimes just getting it done quickly is actually the best step. Other times reading a social story ahead of time is helpful. Watching the injection process, maybe on a sibling and knowing what's going to happen, or on a prior video that's created by your team, or waiting in the car for an appointment, because being in the doctor's office is very high anxiety. So having less time in there is helpful. Number 2, what provides comfort or soothes your child? So sometimes the act of bringing something from home, a favorite toy or a special blanket. Sometimes music or a book is helpful. So these are things that you can incorporate in your practice that would make it easier for the patients to get through this vaccination process. How does your child communicate? So understanding how they communicate is helpful. So whether it's verbal or they're using an electronic device, whether they're using a visual schedule, and that's very helpful to them, or sign language or body language. Number 4, please tell us how your child's sensory preferences by sight, sound, smell, taste, and the other senses that we had already discussed are important. And then options for that are things like having a private room, low lighting, or even having the exam door open. Some people feel that bad things are going to happen when the door shuts. So it's helpful to have that door open and feel safe. And number 5, we talked about, please tell us about your child's interest. So sometimes knowing their special character or their special superhero and discussing that throughout their visit, however short it is, it's helpful because it provides them comfort. And Jess Rabideau is going to go next. She is also one of our Empower members.
Hi, my name is Jess Rabideau. I'm one of the child life specialists here at the University of Vermont Children's Hospital, and I cover the inpatient pediatric unit and the pediatric intensive care unit, and I'm also part of the Empower team. I just wanted to add on to what Leanne was saying about the questionnaire. And if your office doesn't have the opportunity to do that, or you have a patient come in on short notice, even taking a golden moment at the beginning when the patient and family walk in the room to ask some of those questions just on the fly will be really beneficial and create a more positive experience for both staff and patients and families. Today, I'm going to talk about the comfort positions. And in the early 1980s, a child life specialist and a pediatric nurse pioneered the comfort positioning techniques in the hospital setting after observing how children were often brought into a different room without a parent present and held down for medical procedures. These experiences were often traumatizing for children and their families. So they developed a comfort measures model for healthcare staff to use. And this includes preparation for the child and family prior to the procedure, utilizing the one voice approach, positioning the child in the least threatening way, which is usually sitting up, and having the child choose an engaging distraction technique. The goal of this model is to increase comfort and cooperation of pediatric patients while performing tests and procedures. Comfort positioning also provides an active role for the parent during this stressful time and allows the child to be either in their caregiver's lap or next to them for comfort. And if you think about developmentally, around the age of 6 months, many children learn to sit up and have that head and trunk control. And they often, after that, feel a sense of control and security in an upright seated position. Next slide, please. Now we're just going to go over a few of the comfort positions. We're going to start with the chest to chest, which is the child's chest to the parent or caregiver's chest. You can see that the child in the first picture is straddling the parent, and the parent just reaches in and gives a hug to comfort the child, and the nurse is able to give the injection. The picture on the end is also an example of chest to chest with the child in the pink shirt. And this can be used with a child who has a larger body size. They can sit on the exam table and the parent can stand facing them chest to chest, and again, either engage in a distraction item or give a comforting hug during the procedure. The two middle pictures are of back to chest. So it's the caregiver's back, the child's back to the caregiver's chest. And in the second picture, you can see the caregiver take her leg and position it over the child's legs. And we often will have children who may wiggle or kick, and this is a really great technique to help keep their body stabilized and more still for the injection. And from any of these positions, you can gauge in distraction. Next slide, please. The next positions we're going to talk about first, the one in the center with the girl in the floral dress. This is a side position. We're sitting in the parent's lap. This can be done like many positions, either seated on a chair or seated on the exam table. Again, this allows the parent to embrace the child, and again, they can engage in distraction off to the side. This position can also be done with the child sitting on one of the parent's legs, and then the parent sandwiching their legs kind of closed to, again, minimize wiggling and kicking, if you're able to do it that way, if the need be. The two pictures on the outside are really great for children of a larger body size. There's the side-by-side sitting on the far left where he's getting an exam in the mouth. This one can be done sitting on the exam table or sitting in chairs side by side. And again, it's just that companionship and comforting, being next to each other and holding and hugging. The one on the far right where the girl is blowing the pinwheel is, again, for a child with a larger body size who also is a little more stable and secure in terms of not moving during the procedure. But the caregiver is right there holding the patient's hand, which is often comforting, and engaging them in distraction. Next slide, please.
Thank you, Jess. I want to go over sensory supports, and first looking at sensory support can help a child regulate in a stressful situation. Supports can be built into the environment or individualized for the child. The comfort positions definitely can be individualized, and what we had gone over previously with the checklist is looking at your environment and just taking a walk through your own clinic, looking at the brightness of the overhead lights. You know, can you open the shades to give more natural light for those children that would benefit from that? What about the sounds in your clinic or in your office? And so often, you know, there's just sounds that can reverberate. Is there a way of having a room available at the end of the hallway that might be more quiet, or having a background music or a noise machine so that you're dampening down some of those very stimulating sounds? Some of the children definitely benefit from the door being open, that freedom of not being closed in. Others are sensitive to temperature changes. And I know in the summer, sometimes our offices are very cold with air conditioning, and in the winter, they're a little bit too cold as well. So just trying to get an understanding of that. What is the temperature sense in your space? Because having the child come in a short sleeve shirt is really going to make it a lot easier to give the injection, however they may be chilly. Some children do need more verbal and visual direction together. And we will be having a visual picture schedule in your sensory bins so that there is that step-by-step direction that a child can see and the parent can see while they're getting ready to get their vaccination. At the beginning of each appointment, we had said it's important to take time to speak with that caregiver to learn about coping skills and sensory tools that work best for their child. Just to give you a few examples, is there a favorite toy from home, a stuffed toy, or a book the child could bring with them? Some children have weighted lap pillows that are about anywhere from 3 to 5 pounds, and a lap pillow just gives you that extra proprioceptive input, gives you a little bit more comfort. They could bring it in from home. Some children respond very negatively to light touch, and they do much better with a firm but gentle touch. So that whole idea, light touch stimulating, deep pressure touch is calming. How we might incorporate that for an individual child. There are children, again, as we talked about with comfort positions, they need that extra trunk support. They need that extra control as they're sitting on the exam table. And we'll go into that a little more in detail when we get into other individualized vestibular and proprioceptive ideas. The child might wear sunglasses if you can't adjust the lighting, or wear a baseball cap to shade their eyes from overhead bright lights. And some of our children do have communication boards or communication devices that they need to bring with them, because if they have a question, it would be good for them to use their device to ask you. We recommend creating a menu of available sensory tools in order to offer the child during the vaccination appointment, sensory support items can calm, distract, and redirect. And I think when Ashley, when you talked about how your daughter loves having that sensory tool menu that she can pick something before having her procedure, it's a very powerful thing for a child to have that control. Next slide, please. So Jess and I are going to go into more detail on individualized sensory tools, and I'm going to start off with targeting the vestibular and proprioceptive systems. Parents, caregivers, and/or staff can play a very active role in decreasing stress by helping the child engage. And one way that you all can engage is with deep, slow breathing. Many children benefit from visual imagery, and one of the slow breath techniques we use in preschools and kindergartens is the whole idea of inhaling to smell the flowers through your nose. And if you want to do it with me, inhaling through your nose, holding your breath for about 4 seconds, and then exhaling with pursed lips to blow out the birthday candles. And if you do that 2 to 3 times, just that slow, deep breathing, it can really bring about that feeling of calmness. Another idea that we're going to show you later, Jess will show you with the expanding ball, which is a fun tool. But I also want to mention just sitting with the child, if the child is on the parent's lap, putting your hands on the child's belly, having the child inhale, and the parent as well. Inhale, feel the air fill their belly, hold the breath for about 4 seconds, and then exhale. And as they exhale, the air in their belly is going to flatten their belly. So those are just some simple visuals for breathing. We talk about gentle rocking as being soothing for children, and we all do that with very young children. However, we will notice there are children with developmental disabilities that do like to rock. A parent could sit with the child on their lap. The parent and the child could rock slowly, side to side or front to back. And rhythmically is a key for the rocking. So slow rhythmic rocking. The rocking needs to stop though at the time of the injection. So that's a great time to go back to the breathing. And then once the injection's over, go back to the rocking. We have other children that are sensory seekers, and they may be rocking as they enter your office or your exam room. They find rocking something that can calm them, and they may do it a great deal. These are some children that would benefit from a social story before coming into the office, that they know that when they get the injection, they have to sit still. And if they can't sit still, then a parent or a caregiver may need to help them, because it will make it safer for their body when they sit still to get their injection. So that idea of gentle rocking, or a child that may need more motor input, how to deal with it in some kind of preparation. We recommend that we talked already about the comfort positions, but for some children that are older and taller, having a chair or having support as they sit on the exam table, so their feet are supported either on a stool, on the floor, or on a simple crate. It can give them better balance. Think of yourself sitting on a high stool without your feet being supported, without a back support. So that kind of sitting positioning with foot position is important. If you can have a chair that is the right size with side pieces for a child that's 10 or 12 years old, that gives them a better sense of security when they're getting their injection. Okay. I think the very end, last piece, these and other techniques utilize the vestibular and the proprioceptive systems, the hidden senses. And Jess is now going to take it away with the other senses.
Okay, thanks, Karen. I'm just going to run through some of the sensory tools that you're going to be receiving in your kit. These will help you to meet your patient's sensory needs, and they will also help to normalize the hospital environment. a child coming into the room who may be fearful knowing they're receiving an injection might get excited or have decreased anxiety, seeing some of these sensory tools and engaging with them. Some of the sensory tools touch upon more than one sense at the same time. So this light up wand, for instance, is visual, but it also does vibrate. So some kids just touching it and feeling the vibration is really a sensory thing that appeals to them. The lights, you just need to be careful and ask if the child has any seizure history that's triggered by lights. That's a good thing to ask just with any light up toys. The stress ball kind of has Orbeez in it. And again, it's definitely a visual thing as well as a tactile thing, and really is captivating for a lot of kids. The rain stick, both visual and auditory. There is a little vibration too when the balls go through. For oral, there'll be a teething necklace that is a one-time use. The pop tubes, again, sound, sight, very popular. The child could have one hand and the caregiver have one hand on it. The liquid motion timer, visually, it can be very relaxing and captivating. This is also another great tool to use if you have a child that is exhibiting some stall tactics and trying to prolong the time. Oh, I'm not ready yet for my shot. I'm not ready yet. You could give them kind of a deadline to end that anxiety by saying, well, wait till the color runs through and then it's going to be time to have your needle poke, or I'm going to count to 10 and then it's going to be time to get it done. We also have the expanding ball that Karen touched upon. That again, visually is captivating, and a parent and child can each put a hand on and expand it. This is also great. I use this a lot to cue breathing, taking deep breaths out and in, just like the ball. We also will have scented chapstick in your kits. This really helps for the sense of smell. There are definitely some kids who are triggered in a negative way by the alcohol wipe that you use to clean the skin before the injection. So this can be used repeatedly if you have a clean mask in your office and rub it on the inside of the mask and give the child that mask. It becomes a one-time use if you rub it inside of the child's own mask that has been on their face already, or if you wipe it, rub it on their upper lip, then they have to take it home or have it thrown away. And lastly, the I Spy boards, different sizes, but we use these so much for a visual barrier between the child and the injection. A lot of kids, their anxiety, as you know, increases significantly seeing the needle. So having this there, even if they don't want to do the I Spy, really is beneficial. And then if they do want to engage in the I Spy, it's a great distraction. Next slide. We're going to talk about Buzzy, the bee, which some of you may or may not have experienced yet. Buzzy is a vibrating device which incorporates a cold pack, like an ice pack, and the combined effects of the vibration and the cold interrupt the pain sensation of a needle poke, which reduces perceived pain. So for Buzzy to work, you take the wings that are kept in the freezer, frozen, and you put them on the Buzzy. There's a button that you push for it to vibrate, and you hold it on the injection site for 30 to 60 seconds before the injection. And then when it's time for the injection, you slightly move it upward so that it needs to be in between the brain and the site of the pain to be effective. So using the body's own nervous system, the gate control theory invokes the concept that the final common pathway for sharp pain to the brain can be shut out by the nerves that transmit the cold and the vibration senses, which stimulates the cold receptors that will then dull the needle pain. We use this a lot, both inpatient and outpatient here at the hospital, and have found it to be very therapeutic for children of all ages. I think next slide.
All right. It's Leanne again. So now I'm going to discuss options to consider when you decide what works best for your practice's workflow and how to incorporate this into your vaccine visits. So when you are gathering the information, there's different ways you can do this. So one thing that might take a little more time and you might be not to do this month as we're starting, but something that you can incorporate down the road is actually adding it into your online My Health page. And that way they can actually fill out the questions when they're scheduling for their appointment. Another option would be to email the questionnaire to the family and patient prior to the visit. Another option would be you could complete the questionnaire as they arrive to the vaccine appointment. Then there's the option of having the receptionist or the nurse ask the questions when scheduling the vaccine. This is a really great option, especially for those that are not with English as their primary language. When these questions are asked and when they're done ahead of the appointment, it gives the child the opportunity to prepare with a social story or to bring that special blanket or stuffed animal or some of the other things that we've discussed. What simple changes can we make to the physical environment? We've discussed some of those, but just reviewing them, some of them again. Having the low lighting, the softer textures, a room with a temperature around 68 to 72 degrees is ideal. Reduced visual stimuli, bringing their favorite comfort item or using a weighted blanket on their lap, having that door opened again, or having a private room, a crate for their feet so that they're not dangling. These are things that you can incorporate into your practice and begin some of these right away with your vaccines as they're starting shortly. Next slide.
Hello, I'm Jennifer Hazelman. And as a parent, partner, and a mother to a son with complex special healthcare needs, we want to thank you wholeheartedly for attending this training. Our son Logan has experienced a life-changing victory through accessible healthcare practices. Let me take you on our vaccine journey over the course of a year. We adopted our son Logan and his two siblings from the DCF system in March of 2020. Logan has severe vaccination intolerance and phobia of needles. He also has PTSD, ODD, sensory processing, and ADHD diagnoses. We share our story because with collaborative teaming and creative planning, success is possible. Logan benefited from having a multidisciplinary team collaborate to allow success with vaccines. We worked over a course of months with his primary care provider, nurses, school team, behavior team, and psychiatrists to create a plan with him. As parents, we understood the necessity for vaccines and that we had a critical role in this process. It was never lost on us that Logan would require out-of-the-box thinking, creative planning, explicit teaching, rewards, a social story, visuals, vaccine games, trusting relationships, time, and commitment. Not receiving vaccines was never an option. We always approached each vaccine attempt by praising the small successes Logan achieved, and we made sure to champion him in this personally difficult process. We would leave each appointment letting him know we were proud of him for trying. While it was frustrating to hit barriers and roadblocks, for example, we discussed the use of the pediatric sedation comfort zone for his 4th attempt, but it was not covered by his state insurance, and the option to pay out of pocket was not an option for us financially. So our focus remained being his biggest cheerleaders and reminding Logan that he could do this. We even coined the phrase with him, "Not yet, but you will." The strategies you have heard in this presentation were implemented with our son and ultimately led to his success. The practice we partnered with Timberlane Pediatrics Milton allowed for us the use of a comfortable alternative space that had a couch, low lighting, sound blocker that was right next to a single stall bathroom, a recliner chair in the space, and sensory items. We even brought the vaccines to him in the comfort of our family vehicle. With each vaccine appointment attempt, the same staff is scheduled to build a positive rapport. And most importantly, it is their investment of time, which ultimately created trust. At times throughout the multiple unsuccessful visits, 6 appointments, approximately 30 to 35 hours, we didn't know if we would get there. But what we did know is that we were all committed to Logan and his success with receiving his vaccines. It takes a village to raise a child could not be more true. It definitely took many people to cooperate to achieve vaccination success. We understood the urgency of vaccines, that skipping vaccines leaves Logan and those around him vulnerable to illnesses, at greater risk for serious infections, and that it is vital to participate in preventative care so that both Logan and I would miss less school and work. Unfortunately, we also found ourselves advocating and educating my place of employment, the Burlington School District, that supporting our son was a necessary and valuable use of time to meet the challenging medical, emotional, and behavioral needs of our son during a very medically fragile time as the United States of America and the world continued to navigate the COVID-19 pandemic. Vaccines are so important to overall health that it can truly mean the difference between life and death. On January 25th, 2021, Logan completed the vaccine so he could be healthy and attend the 7th grade in the fall. Most importantly, now a year later, from the start of his vaccination attempts, Logan is very proud of his vaccine accomplishments. His anxiety has lessened, and the vaccine sensory plan is implemented for his individual personal success. He is empowered and without hesitation self-advocates, as was seen when he received his flu shot this fall. He immediately after we checked in for his appointment, and he watched his siblings head off together in the regular exam room for their flu shot, stayed back, and directly walked up to the check-in counter and asked the receptionist, "Is the room I use for shots available? And is Nurse Vina available?" The practice was ready to answer his self-advocating questions, replying confidently and immediately assuring Logan both the room and Nurse Vina were ready for him. As an ultimate indicator of success, Logan generalized his vaccine success by receiving his COVID-19 vaccines at Costco this fall, relying on the trusted vaccine sensory plan strategies being implemented. Logan has overcome what started out to feel impossible and likely would have been if our village didn't stay committed and work together as a team. Additionally, Logan loved that ice cream sundae from McDonald's as his chosen reward. So now you might be thinking, easy peasy going forward, right? Well, actually, no, not at all. But the takeaway we want to emphasize is that supported and empowered parents and children, given voice and choice in the process, along with caring, compassionate professionals, all working collaboratively, never losing sight of the goal, makes all the positive difference. Thank you, Nurse Vina. Thank you, Dr. Bullock. Thank you, Dr. Strokoff. Thank you, NCSS CAT team. Thank you, BFA Fairfax IEP team. Thank you, Vermont Family Network, for seeing the value in this training and making it happen. And thank you to all the partners in this presentation. And a great big thank you to all you medical providers here today, giving your time already stretched so thin. You make all the difference, and you truly make a difference every day. I speak for our son Logan and all parents of children with complex needs. We have sincere gratitude for your partnership. And I wish to close with a quote by Margaret Mead. Never doubt that a small group of thoughtful citizens can change the world. Indeed, it's the only thing that has ever. And there is you can see there's a text on the right-hand side of this slide. And this is my son when he experienced success as he generalized in a new environment with different people using his sensory, his plan for vaccines. So proud. And so I guess that we would say to you is, you may not be able to do it yet, but you will. With patience, practice, courage, grit, anything is possible. The value of a growth mindset, working towards small goals, waiting for the right time. And boy, did we wait. And learning patience and resilience is indisputable. Thank you.
Thank you so much, Jennifer and team, for this incredible training. I don't want to spend too much more time on slides. This is a wonderful quote, but I'll let you look at it as you receive these slides, via your email. But I did want to say, we've just touched on some things that you can do, in your practice and in your workflow to make things better for really all children, but specifically children with developmental disabilities, delays, or sensory sensitivities. If you have any questions about implementation, please contact Vermont Family Network, specifically Jamie Rainville, or you can contact me, Charlotte Safran. I helped implement the Empower program at the Children's Hospital. So either Jamie and I would be happy to answer your questions via email, but we have time for some questions and discussion now. Thank you to the Vermont Developmental Disabilities Council and the University of Vermont Center on Disability and Community Inclusion. So with that, I think I will stop screen sharing and we'll open it up for discussion. Does anybody have any questions, any reactions? Nice job, team, on packing that all in to about 52 minutes. It's so quiet. I believe somebody asked in the chat, when will practices be receiving their sensory support items? And Jamie Rainville did say that in the chat, but it sounds like we have time for me to say it out loud. You will be receiving the sensory support items in a bin. I believe they're getting those out to you next week. And as I said a few times, you'll also have a copy of the slides that were presented, a PDF version of these slides for your reference. Karen Downey and Jessica Rabideau, the OT consultant and child life specialist, have also compiled a tip sheet for practices to reference as they think about implementing this. So you'll be receiving that as well. And I said this at the beginning of the training, and I'll repeat it. Jamie has also put it in the chat, but we would be so grateful if you would take 4 minutes to complete the survey that we have for this training. And, you know, maybe you don't have any more questions, so you want to pop right off and complete that survey now, which would be totally fine. So yeah, please definitely complete that training, that survey. And thank you again so much to everybody who worked so hard to pull this training together. But also thank you all so much. As we've stated a few times, we recognize how full everybody's schedules are. And for you to take the time to attend this 1 hour training, we're very, very grateful for your commitment. So thank you so much for doing that.